Hey everybody, it's Dr. Mary Gardner with Lap of Love, and today's Facebook Live is about canine arthritis and what you need to know about it. And I thought I'd bring in an expert. And so this is my first person to have back again on, it's not like I'm Oprah or anything special, like having a returning guest, but I thought I would bring back Dr. Kristin Kirkby Shaw and into our stream. Let me add you into my little stream here. Back again. So welcome.
Hey, I'm honored. I didn't realize that that was the case. It's great to see you again.
Yes, you're my first repeater.
Awesome.
There might be a word for that. But we talked about laser therapy last month, and I just thought, you know, we spoke so much about arthritis and how lasers can help and how Sissy Loop can help with pain and inflammation. So we had to just talk about the big elephant in the room and talk about canine arthritis. Mm-hmm. and what the heck is it? So, oh boy, we got Rick from Irvine already on the line. Everybody's ready. We got 35 people listening so far, and we just got started. So clearly this is a big problem out there, Dr. Shaw. So can you just in general explain what arthritis is?
Yeah, absolutely. So, and when I'm talking to clients, this is the first part that I start discussing, because I think it's a word that just gets tossed around and we assume that dog owners know what it means. So on the most basic level, arthritis means that the joint is abnormal. So then what is a joint? So the joint is where two bones meet, and the ends of the bones are lined with cartilage. And cartilage is what allows the bone to flip and slide and move without any friction, but also without any pain. So another important point is that cartilage, if you imagine it's like this nice white shiny surface to the end of the bone, cartilage doesn't have any nerve endings in it. It doesn't have any pain receptors in it. Okay. So arthritis really is when that cartilage starts to wear away, and we talk about, you've heard the phrase bone on bone pain. When that happens, that means that now there's these nerve endings that are underneath where the cartilage was. They're now exposed, and pain starts to result. Is a result of that. As that cartilage starts to wear away, there's all of these secondary changes that happen within the joint, where we have swelling. So we have kind of more fluid that develops in the joint. We have atrophy of the muscles around the joint. So there's all these kind of secondary things that set in. But pain is also something that obviously starts happening once we have that cartilage start to wear away.
I can hear my mother saying, "I've got bone on bone pain." Like that's the she all the time, and it happens so often. So I know I've got a little stat here to show how many. Look at you. I see 1 in 5 dogs are affected with arthritis.
Well, actually, that honestly that's the statistic that's thrown around most often. That 20% of dogs have OA, or so osteoarthritis is or OA. That's the acronym that you'll hear veterinarians use for general arthritis. Actually, the more recent statistics suggest somewhere between 30 and 40% of dogs have arthritis. And that is still probably underdiagnosing it. We know that about 50% of dogs at least are overweight, and dogs that are overweight have a much greater likelihood of having arthritis. So I tend to think of it probably closer to that 40% of dogs have arthritis.
I would probably agree with you. I think we see it at Lap of Love. We see so many dogs. We help so many dogs. And I want to just anecdotally, like a half have some kind of arthritic pain, right? Like, and we see the old guys. So when do dogs start getting arthritis?
Yeah. So this is the misconception is that dogs develop or get arthritis when they're older. So there's a big difference between dogs and people when it comes to their type of arthritis. So people, and actually incidentally cats, they tend to get what we call primary arthritis, where it's literally just as you age, it's just wear and tear, your joints just start to degenerate and weaken.
Dogs, people and cats.
People and cats. So people and cats, and then we've got dogs. Dogs typically get what we call secondary arthritis, which means that the arthritis is due to an underlying disorder of the joint that most of the time they were born with. So hip dysplasia, elbow dysplasia, OCD, these genetic conditions that are usually should be able to be diagnosed in the dog's first year of life, those are going to cause arthritis. Other causes of arthritis in dogs would be like an ACL tear, a cranial cruciate ligament tear, or a fracture that involves the joint. All of those things are the most likely things that are going to eventually lead to arthritis. And because of that, we should be able to identify actually dogs when they're young, or at the time of that cruciate ligament diagnosis, and say, all right, we can predict you're going to develop arthritis. Nobody wants to hear that. Nobody wants to hear that their puppy has hip dysplasia and is then going to get arthritis. But this is the when I am talking to veterinarians and my own clients, the big key is the earlier you diagnose it, so many more options you have, and the better that dog's life is going to be, because you can start intervening early.
Okay, so as a veterinarian, when I was in private practice, so you're saying like when they're in there for their 6-month exam, a year exam?
I actually, so there's certain breeds that are going to be at greater risk for hip dysplasia, elbow dysplasia. Mm-hmm. Hip dysplasia in particular, that can actually be diagnosed when dogs are 4 months old, when they're 16 weeks of age, by an exam technique called an ortolani exam. And that's where the veterinarian manipulates the hip to feel for any looseness in there. Now, that exam technique, usually the dogs need to be a little bit sedated because it's not typically comfortable. But that's the earliest you can start looking for hip dysplasia. So my advice is actually any dog, a Labrador, German Shepherd, Golden Retriever, dogs that are genetically at risk, to start looking for it at that age. Otherwise, if a dog, say, has elbow dysplasia, they are usually going to start showing some limping in that first year of life. So
really?
Yeah. So if a dog that's less than 1 year of age comes in with limping, they have a developmental orthopedic disease, meaning something that they were born with, until proven otherwise. And if it's in the front leg, it's usually the elbow. It can also potentially be the shoulder.
Okay, so I'm going to throw myself under the bus here. Now, you know what? Because you're my second timer, I really didn't do you like any justice on explaining how awesome you are. So everybody can see down there the purple, all your letters, which means you're super smart and boarded in veterinary surgery and rehabilitation. So, and you were with me at the University of Florida. Well, you were already going for your surgery residency when I was just a wee little student. But I'm gonna throw myself under the bus. I don't think when I graduated, I was comfortable doing this ortolani, and I don't think, or should the pet owners ask their veterinarians if they're comfortable with it, or should they go see a specialist? So
you are not alone. So I talk about arthritis and these things that we're talking about all over the country. Veterinarians, it used to be in person and now it's a lot of Zoom. And most veterinarians don't feel comfortable doing ortolani exams. And so part of the reason that we may talk about the website, but part of the reason I created the caninearthritis.org website was to help.
Let me put that up there.
So it's Canine Arthritis Resources and Education. There's a dog owner section to this website and a veterinarian section where there's videos on how to do an ortolani exam and the importance of it. And so I do a lot of trying to educate, because you're definitely not alone. I'd say most of the vets that I talk to feel uncomfortable about orthopedics in general, and have probably never done an ortolani exam. So do you have to go to specialists? Absolutely not. I would say that most surgeons would love to see a puppy, but they're probably not going to want to take their schedule up just to do an ortolani exam.
Okay.
However, we might get into treatment. There is a surgical treatment that can and should be done in dogs that age, 4 to 5 months of age, that can protect from hip dysplasia or protect from arthritis. But the point is that most general vets should learn to be able to do an ortolani exam on dog breeds that are at risk.
Okay. So listen, I think this is great for pet owners to know about this website. And I want to get back to this more in a little bit for themselves, but even to let their vet know about it if they don't actually know about it, because But I was orthopedic. Listen, there's a few O's that I was scared of. Orthopedics, oncology, and ophtho. Like O's that I was like, I felt I needed a little bit more help with. So, okay, so let's talk about. So let's say we were able to diagnose based on exam, and they were young enough. What are some things what are the recommendations that we can do, or options if they see these developmental changes or that will happen and turn into arthritis?
Yeah. So I divide the treatment options into kind of 4 quadrants. One quadrant is pain management. And so if a dog is limping, if a veterinarian detects pain, then pain management should be started. And that's something to talk about with your veterinarian, but it's usually a non-steroidal anti-inflammatory is usually the first line. Then and I've seen there's been some questions about supplements.
I know.
Yeah. So one thing that may happen is you might diagnose hip dysplasia, but there might not be any limping. There may not be any pain. So these are cases where we want to be proactive. So you can use oral supplements. There's very, very, very little research supporting supplements. If you're going to use supplements, and I think you should do a whole other Facebook Live.
I think I will, and I think I know who I'll invite.
So the keys when you're choosing a supplement are make sure that the quality control is there, because there's no regulatory body telling anybody what they can and cannot put in a supplement. So you want to make sure that it's veterinarian recommended and that they're comfortable with the quality control that goes into it.
So that a vet might be on their advisory board or something like that, looking at their quality control.
Yeah, most ideally, it's more about that there's a third-party lab that's testing the supplement, that's saying, that there's nothing in here that shouldn't be, or that the ingredients meet the label claim. So you want to look for, there's the National Animal Supplement Council, NASC, which is a little yellow kind of circle, little sticker that will be on the supplement. That's what I look for.
We'll post that link.
Yeah.
Deanna's in the background helping me out. She posts something, I'm sure.
You'll see ones that say GMP, which is good manufacturing practice. You can look at consumerlabs.com. But really, for me, and when I'm talking to veterinarians, I recommend to veterinarians pick 2 or 3 supplements that you recommend and you feel comfortable with. So your client doesn't have to do all of this research out there.
Okay. Yes.
So oral supplements are easy, but there's very little research to support most of them. The one falls into a supplement category that does have a lot of research to support it, and I absolutely recommend it for any dog at risk of arthritis or has it, is Adequan.
Yeah.
So Adequan is given as a shot, so it's given as an injection. I recommend giving it sub-Q. The label, the FDA approval for the label is to give it IM, intramuscularly, but that's painful. So anybody that's ever had a shot in their arm, you're kind of sore for a few days. So I am adamantly opposed to giving it IM. We teach our clients to give it sub-Q at home. So Adequan for sure, ask your vet about that.
Yeah. Okay. So that's the supplement category.
Mm-hmm. So that's the supplement category. So the single number one most important thing to do, there's no way that you can over supplement or do anything that's going to be more important than making sure the dog doesn't get overweight. So on the skinny side of normal. So we want dogs that have any sort of at risk for arthritis or have arthritis, they have to be on the skinny side of normal, which means that you should be able to easily feel the ribs. There should be a nice waist from the side and from the top. So scientifically, this is clearly the most important thing for decreasing the chance of developing arthritis. And if they develop arthritis, the symptoms are much less significant. So then when it comes to weight loss, it's 80 to 90% about decreasing the calories in. So going on a diet or making sure that they're not getting too many calories. And then only 10 to 20% is really about the activity or the calories burned. Unfortunately, that's the same for people too. Like if you're ever trying to like track calories in or out, it's depressing how much you have to work out to burn like a cookie. Yeah.
Oh my God. Okay.
Weight management, single most important thing. Nobody likes to hear it, but there's nothing else that's more important. But then the kind of the next category is activity. So what activity should dogs be doing? What's good and what's not good? So what is not good is being a couch potato. So in the old days, I think people say, oh, dogs have arthritis. They should just, take it easy on their joints and not do too much. That is completely wrong. We actually want dogs to be active. We want them to go for regular walks, meaning ideally every day. Swimming is great. So low impact, regular, controlled activity. So which is really just going to be a lot of walking. What we don't want dogs to do that have any sort of joint disorders or arthritis is high impact. What that mostly means is jumping. So especially jumping down. If a dog has any elbow dysplasia or elbow arthritis, jumping down is so much pressure on their joints. You want to avoid that. This is the other one that people hate to hear, but it's true, is playing fetch. So that running as fast as they can and stopping to catch a ball is really tough on the joints. So, this is the conversation that I have a lot with my clients. If your dog lives to play fetch and lives to chase the ball, we're not going to say, okay, they can't do that anymore. It means that we're going to have to be a lot more aggressive with our pain management. We're going to have different expectations that, your dog's probably going to limp a little bit more. And maybe they shouldn't play fetch for quite as long as they would like to. You have to be a little bit of the bad guy in sense that say, all right, you're only allowed to play for 5 minutes and then we have to cut it short. So reducing the high impact activity, regular walk. So there was actually a study that showed that dogs with hip arthritis that walked 60 minutes or more a day had less symptoms than dogs that walked less than 20 minutes a day.
Oh, that's huge.
Yeah, it's a really cool study. But the important thing is now I don't want everybody to go out there and say, all right, I've got to start taking my dog for an hour walk every day. We saw this.
Then he's going. It's like, we're going for a walk.
No, we saw in the early days of the pandemic is people were like, I've got all this time. We're going to take my dogs for all these walks. And dogs were coming in that were having all these kind of new injuries that they weren't ready for it yet. So you want to build up to that 45 to 60 minute walk.
Okay. So Jenny, just a little one. Now, what about water therapy, like underwater treadmills and things like that? I love that.
Absolutely. So kind of rehabilitation, physical rehabilitation that generally includes underwater treadmill, laser therapy, CC loop. All of that is going to be really helpful from a pain management standpoint. And then also strengthening the muscles. So initially I talked about the muscle atrophy that usually comes along with arthritis. Underwater treadmill and swimming is a great way to build up the muscles. It's a great way to keep those joints moving without that high impact on the joints. But it is not essential. So you don't have to have rehab. You don't have to have an underwater treadmill. The basics of walking and weight management are really the fundamentals. But the icing on the cake, and everybody loves icing. So if you can get to rehab, it's definitely going to be helpful.
Right. Right. I don't want to scare everybody that you have to go to a specialist. You have to go.
No.
And the point, I think a big lesson that I've learned is diagnosing so much earlier in the dogs. So that way we can change some things. Or if there are some surgical options to do as they're younger, I don't want to say get it over with, but get it over with so that they don't get arthritis.
Yes. Yeah.
Because you don't want to wait. Like, I'm going to tell you, I was really bad. So my Samoyed, I have a picture of her, that dog. Okay. So she had basically a cauliflower for a hip joint. And I was and I'm a vet, and I was like, oh, well, I'll wait. And so not me, she needed hip surgery. I was not going to do that, meaning perform it. And so I actually procrastinated a little bit. And then her bad leg started to atrophy so much. So when they did the surgery that was required, she had a FHO done. So the muscle is required to be like her new joint, and she had like the spaghetti leg basically. And so I think I should not have waited so long to have the surgery done. So sometimes the sooner the better.
Yeah, that's a really good point. I think especially with hips, it's tricky because many dogs with hip arthritis and hip dysplasia will never need surgery if you do all of the other things. But there's also a subset. So my lab, she wound up she actually had a hip replacement, but I was teetering between FHO and hip replacement only because I got a very big discount where I was working. Did we do the hip replacement? But yeah, I think you do everything you can to avoid surgery, but you don't want to wait too long because you're exactly right. Especially with an FHO, you need that muscle mass to help recover.
Right. Oh my gosh. So I want to talk first, before we get to some of these questions, because they've been zooming in. This is, by the way, our most live attended session. So tell me a bit about, like, you really love, I don't want to say you love arthritis, but this is your thing.
It is my thing. It's, you know, and I think it became my thing because my own dog, I've gone through it with my own dogs. And, you know, we've talked about this, how much our own dogs impact how we practice as veterinarians. But my first lab, Bella, she had hip dysplasia, hip arthritis, and, you know, everything that I learned from her, she's, you know, no longer with me. It's been a number of years now, but Beans, who she may make an appearance here. She's my 13-and-a-half-year-old French bulldog who also has hip dysplasia and hip arthritis. I had a dog, Bailey, and so I've gone through so much of it personally. And then as a surgeon and a rehab specialist, my career, my job has really been to bridge the two. So, you know, I do orthopedic surgery, but I also see rehab patients, and arthritis really is the condition that kind of bridges between the two. So yeah, I guess it's my thing.
It's your thing. Yeah. I love it. So when did you start this website?
So CARE was started and it was launched officially to the public in August of 2019, but we started kind of the writing process and putting it together 2 years ago this week, actually. So it's been out for about a year and a half, and there's we've got almost 5,000 members between veterinarians and pet owners. And it's free. So whether you're a veterinary professional, a vet tech, you know, as a veterinarian or a technician, you sign up because you get access to some different information that's basically written towards the veterinarian. The pet owners, you just go on the website and click around.
Right. I happen to be there. My little article. So
yes, of course. And so, and, you know, it's not just me. So I started with writing the stuff, but we have a number of amazing specialists and guest contributors that, you know.
I love it.
Just like you.
I love it. Okay, so I'm going to hit some of these questions. Let me put my little scroll bar because we've got a ton. And by the way, so many people from all over the world, even from Ecuador, a lot from California, somebody from South Florida where I'm at, and you're over there on the West Coast. So let's see. Let me get down to the questions here. And some of them we might have hit. I know it's hard to see them in pain. Okay. Wait a minute. So, oh my God, the girl on the left looks like my twin. Am I on the left or is? Okay. Wait, I think I'm on the left on my screen, but I don't know if it's turned around. Okay, so she's doing okay. I was crushed to know my girl had it, and she's just 6. So I'm assuming arthritis. Her vet said it's likely hereditary. So probably the thing that brought it on was hereditary. Now, just a quick question. So the cats, I know this is a canine arthritis discussion here, but the cats, that was very interesting that they're more like us. We just get it, right? Like
it's kind of just an aging wear and tear on the joints. But there was a recent study that showed that 91% of cats have arthritis. So basically most cats, the older they get, they're going to have arthritis.
And that's not because they have hip dysplasia or something else.
Not necessarily, yeah. They can just develop arthritis, and they're worth a whole other discussion because they're trickier to diagnose for sure.
I can't even imagine. Okay. My dog always wants me to rub her legs, and I do because it makes her feel better. Betty. Yeah. So what about like massage?
Yeah. So massage makes you feel good, right? So what massage does is it helps bring in blood flow to an area, and it may be able to reduce some of the muscle spasms. So what happens if this joint is arthritic, and I talked about some of the muscle atrophy around the joints, the muscles will also start to kind of go into a spasm, and massage can potentially reduce some of that muscle spasm, but mostly it just kind of feels good. And when you like bump your elbow and you just kind of do that,
Yes.
rub it to feel a different sensation. So massage can sometimes trick the spinal cord and trick the brain to feel something good rather than feeling the aches that come with arthritis. So yes, massage is great.
I love it. Okay. So Cindy said, let me see, she took her pup less than a year old for a swim lesson. The therapist told me my dog would have arthritis when she's older. This was based on her massaging my pet in the water.
I guess I would say that there are a number of very, very, very well-meaning people out there that are like massage therapists that do water therapy with dogs. They're not veterinarians. So if there's any concern, then I would talk to your veterinarian. But, they are, massage therapists that do water therapy that are experienced with seeing dogs. They may be feeling something that in their experience does think that they're going to lead to arthritis. So I would say if that's at all a question, talk to your veterinarian about it.
Yeah, for sure. We got a lot of weight questions. Michelle's got a 15-year-old mixed breed, and my 6-year-old Akita has it. Akita could stand to lose 15 pounds. I had my Doberman, that's his picture there, and he was on the slim side. Like I always like to try to keep my dogs on the slim side because I'm always so worried. And people would say to me, your dogs are too skinny, because I think we are now accustomed to seeing tubular dogs.
Yeah, they should not be. Yeah.
Right? Like we see a little waist.
You should see a waist. The other thing is you should be able to feel the ribs. Like if you run your finger over the top of your hand and you can feel each bone in your hand, that's how it should feel when you run your hands over the side of a dog and feeling their ribs.
And just gently rubbing, not digging in trying to find it.
Yeah, no, you should easily be able to feel and count each rib. If you're doing this, like over your knuckles,
you're emaciated.
Just kidding. Yeah. Yeah. But if you have to push to feel the ribs, that's too much. And if you don't see a nice waist from the side and from the top, that's a little too much.
I have another dog who's like 6, and he's stealing Sam's food because she's like has issues. So he's got a pass right now, but he needs to we walk 3 miles every day.
That's awesome.
Lori's got a dog that needs to lose 8 pounds. So just somebody has some heart issues, so they can't do the surgery. So there's a lot of people that purchase pets from breeders, and they, like their breeder will say, oh, he's got the mother and father. Like, is there any good tips on if somebody wants to purchase from a breeder?
I think the breeders are going to try and reduce hip dysplasia, elbow dysplasia. Those are the main ones, but they have not fully eliminated. If they had, we would be dealing with this. For hips, the best thing is to have a veterinarian that palpates for ortolani, and do a pen hip exam, which is a type of X-ray that is much better than a traditional OFA X-ray at diagnosing hip dysplasia. So if you can find a breeder that does pen hip exams for hips, that's going to be great. But it's tough because I see a lot of Labradors, and there's a lot of big breeders around my area out here, and I think the breeders really do their best, but there's still some cases that still develop it. So, I would say do your research, talk to the breeders, and see what the parents are like. But it's never a guarantee. Never a guarantee.
Yeah, never. So Crystal says limping usually kneecap issue. No, at least a small breed. Limping.
Well, limping could be anything. I would say limping is a sign of pain. So it means you should see your veterinarian. Skipping, that's often the patella luxation, but like just a limp, that's usually going to be a cruciate ligament tear. If we had to just generalize or guess, it's going to be that until otherwise. I'm
going to tell you, man, luxating patellas used to give me the EBGBs. When I feel, I'm like, ah! Yeah. I feel so bad. So I see a lot of questions about glucosamine.
Mm-hmm. So there's not very good research. Well, all of the research out there in dogs and in humans has been really not been able to show that glucosamine does much. So I don't give glucosamine to my dogs. I don't think it's worth it. But if you're going to, again, make sure it's a product that has independent testing. It's been tested by a third-party lab. Okay. I'll tell you the supplements that I give. So Mobileflex is the one that I give my dog right now. Yeah. Flexidin Advanced is the other one that I recommend.
Okay. So yeah, somebody asked about Mobileflex. So thank you. Yeah. Jenny says, is it given that a 14-year-old has arthritis?
No, not necessarily. Yeah. A 14-year-old cat, yes. A 14-year-old dog, no, not necessarily.
My girl Sam, she doesn't have arthritis. She's got cancer in her spine, which is totally different. But her, like, she's fine. So so don't just assume, right? But you're right. Cats and us.
Yeah.
What about salmon oil, fish oil, stuff like that?
Yeah. Great question. So I kind of glossed over that, but yes, omega-3 fatty acids, specifically from fish oil, is good. So it becomes an anti-inflammatory, and we've heard about it for us for cardiovascular disease and kind of decreasing systemic inflammation or the whole body inflammation. Fish oil is definitely good. I personally don't recommend salmon oil just for sustainability reasons. So I think it's better to get, whether sardines, herring, some sort of small cold water fish is the source. But yes, omega-3 fatty acids are great.
Okay, great.
I should put a caveat there. If you're going to start omega-3 fatty acids, and there's a lot of papers on this on the CARE website, you have to gradually introduce the omega-3s, or else you will 100% guaranteed give your dog diarrhea. So over 3 weeks or so, gradually introducing the fish oil, or it will definitely cause diarrhea.
I did not know that.
Oh yeah.
Good to know. Okay, Sam. I should. Okay, let me see. I'm just trying to see if I've caught most of them. There
was a question about CBD. Are we allowed to talk about that?
Oh, yes.
Yeah. So I do recommend CBD. I live in a state that it's legal for every reason. But there are certain states and there are certain countries where it's the conversation is different, whether veterinarians are allowed to have it or not. So there is a lot of emerging research to show that CBD has a lot of effects on pain, a lot of effects on a variety of different things and systems in the body, but pain in particular, and there's some pretty good research coming out. The product that I recommend is called Elevet. That's the one that does have some good studies out of Cornell University. So again, really important, even more important, I think, with CBD. So CBD is a component of hemp. Hemp is different than the marijuana plant, but you want to make sure that sourcing again from that hemp and that CBD is ideally organic, and that every single batch, whether it's a treat or an oil, is tested for heavy metals and toxins and mold, because those things can show up, and you don't want to give that to your dog. So you want to make sure that it's a trusted product. So if you want to give a random other one, that there's a million products out there, make sure you ask the manufacturer for a certificate of analysis. If they can give you a certificate of analysis, you probably won't know what to read through it, but what it means is that they are testing for lead, they're testing for mercury, they're testing for mold. So that's important to look for.
All right, so you can't just go to like your local green market and pick it up. Like it may be okay, but
yeah,
I would maybe side eye it. Yeah. So Jenny's kind of got an interesting question. Is this reversible?
Great question. No. So arthritis is not reversible. It's not curable. It's progressive, but it is very, very manageable, especially if caught early.
Yeah, because she's got a dog that knuckles. So we've got probably other issues going on, and I think water treadmill might be really good for.
Yeah, and I think I don't want the point to be missed that arthritis is the #1 cause of chronic pain in dogs. And chronic pain is a very common reason for euthanasia, as you very well know. So making sure that you're working with your veterinarian about having the pain component dealt with, making sure that you're identifying whether your dog is in pain, and being really proactive about that.
I know. So like I'm on some Facebook groups and I try to just sit in the background sometimes, but I'll see some owners like, I don't want to put them on any medication. So I have them on some like CBD oil.
Yeah.
Like, I struggle with that.
Yeah, I really do too. So again, trying to understand that pain is, it's different for everyone. But pain sucks, and pain leads to death. In humans, it leads to disability and it leads to depression. I had to euthanize my last dog because I couldn't keep him painful. I couldn't manage his pain. I couldn't keep him comfortable. And that was because I started too late. I waited too late to start giving him the actual medication. And by that point, his systems had already started getting where he's having spontaneous nerve firing, and the spinal cord literally will change so that it becomes easier to feel pain. So you have to start early. I know there's reluctance because of some bad press about certain medications around the liver and the kidneys. It's really, really uncommon to have side effects, especially if these medications are used properly.
Yeah, I get so sad when I see that on websites and then on Facebook groups or something. I'm like, oh, we could help.
Yeah.
Tari's got a 13-year-old lab. She's on gabapentin, Adequan, Dosequin, Novox. Her rear end when she stands slowly falls to the ground, like she can't stand, and her muscles. Do you think that's arthritis or something else?
It's a very good chance it's arthritis. Yeah, I mean, I can't make a diagnosis without seeing a dog. It sounds like symptoms that would be consistent with arthritis, but it could be a neurologic condition also.
See, now, how like arthritis is your thing a little bit more. Like me, because I've had my laryngeal paralysis dog and I've got Sam and like this, like the neurological things and the knuckling, like I just see so much of that too. And it's so sad. So physical therapy, hi from Kentucky, New Jersey, supplements. Oh my gosh. Just trying to think. This is like our most active chat here. I think everybody's chatting with each other a little bit. So that's good. What about ice packs?
Yeah, absolutely. Yeah, so ice is a great anti-inflammatory and pain reliever. And so I do recommend icing after activity. So we talked about the dog that lives to play ball and lives to play chase. So after doing that activity, should come in an ice pack. And ideally you're ice packing for 15 to 20 minutes. That's a long time in dog time. So if you can get 5 minutes, that's great. So you get an ice pack like those Flexi blue ones. Don't use bags of corn or peas. You'll hear people say that. You can, but there's so much air trapped in there that it doesn't get as cold as you'd like it to be. So either get a commercial ice pack, or you can make your own with 2 parts water and 1 part alcohol. Double Ziploc bag it, put it in the freezer, and it will make a nice moldable consistency. Never put the ice pack directly in contact with the skin. So you always need to wrap it with like a dish towel or a pillowcase. Then let's say we're talking about the elbow, you wrap it around the elbow and then put an ice bandage around it. Yeah. Adding that additional compression with the bandage helps the function of the ice. So yes, ice is great.
That was a good question, Crystal. Yeah. I like it. Listen, I think Jenny's going to burst if I don't ask this. She has a huge question. Weather, and then below it she's asking about barometric pressure. So it's a great question that has virtually no research in dogs because it's really hard to track. But certainly I know in my dogs and my patients, people will say that with when it's going to rain or when the barometric pressure drops, that they'll be more achy and they're more sore. So when we're talking about chronic pain, nobody is able to identify that better than the dog owner themselves. So if they notice that their dog seems a little bit more sore or a little more stiff, or their personality changes, they may seem more just sad or dull or depressed, that may correlate with the weather. And at that time, that's certainly a time where maybe you don't need to give pain meds every day, but at that point in time you do. It kind of goes along with it. There's often flare-ups of arthritis. So a lot of times we'll have patients that don't need to be on an anti-inflammatory every day,
We've gotten to the point where they're at an appropriate weight, they're on Anacon, they're doing regular exercise, but then they have a flare up. And then we give an anti-inflammatory for a period of time there. So I see that with weather and with kind of just, who knows why, but these flares.
Yes. Listen, I could have you here forever. And I'm like, oh my gosh, there's so many questions. This is awesome. One other little suggestion or it was a question is, which I like, is that the nails. Like, so many people don't cut their nails. I know this is not like, I know there's so many, what about Rimadyl? What about this? But like, sometimes these little things people forget about.
Yeah, I mean, the home environment. So you and I were talking about this earlier. So making sure that those hardwood floors and tile floors are covered with yoga mats, covered with rugs, and the nails are trimmed short. So again, this is one of the things that if you start early, when the dog's a puppy or a young dog, keeping their nails short, getting them trained to allow you to Dremel them or cut them, it's going to help you so much when they become older and they're having trouble standing up. So cover the hardwood floors, keep the nails trimmed.
I love it. And you're a fan of acupuncture, lasers, of course. We did. Somebody asked about lasers. We did a whole Facebook Live last month on it. Like,
yes, yep, yeah. I don't do acupuncture myself, but I've got 2 colleagues that I work with that do it, so I certainly do recommend it.
Yeah, I love it. All right, is there anything I forgot to mention?
Oh boy, I mean, there honestly is so much more. We didn't really talk about surgery or anything like that. I would just say, again, the highlights are look for it early. So signs of pain, I think that would be the last one, is like, how do you know if your dog's in pain? So number 1, limping is a sign of pain. Your dog just doesn't want to do things that they may have wanted to do in the past, or they don't get up to greet you when you come home. They don't get out of their bed. They don't seem to want to go for a walk, or on the walks are kind of lagging behind. They don't seem interested in sniffing when they're out on the walk. They're just kind of focused on like, oh my God, this hurts. Are they going to make me go any further? Licking excessively of an area. So this is a huge misconception that people think that if dogs are licking their front of their paw here, it must either be that they've got obsessive compulsive disorder or they've got a dermatologic disorder. I'm not saying that they may not have that, but there's also a really good chance that they have pain in their elbow, in their shoulder, or they have a bulging disc in their neck. And it's causing this kind of prickly feeling in their arm. So it's called referred pain. And licking is a soothing mechanism that dogs use to try and soothe themselves. So that's a sign of chronic pain. So there's a questionnaire on the caninearthritis.org website about, is my dog in pain? So you can go through and see a lot of these different questions. Do they sleep through the night, or are they restless? Yeah.
I know. And listen, there are a lot of lab lovers on this, and labs just really don't have ever a bad day. Like they're just they have the joy gene, which so many people, oh, he's wagging his tail, he's eating, he's not in pain. And I see them, I always see like that front limping too, and like a head bop. And I think of equine medicine when we're like down and sound.
Yep. Yeah. Oh yeah. I mean, I'm a lab person, true and true. And so I agree, if they miss a meal, something really, really is wrong. So looking for pain and arthritis is subtle, but you know your dog better than anyone else. So if you think that something is off, or if they're limping, they need to be checked out by a vet.
Yes, I agree. Okay, so I want to thank you so much. I think this is probably one of, like I said, our most watched live. And I want to thank everybody who listened. And if you have any suggestions about what you want to see, also put it in there. But I want to just put your website one more time on there, the caninearthritis.org. And thank you so much for being such an advocate for this topic, for this disease, and being an awesome teacher for me. And what areas do you service? Because there might be people out in the Pacific Northwest that could come to you if you needed.
Well, actually, I'm leaving practice. This is brand new information.
What?
Yeah, I'm not seeing any new patients, and I'm leaving practice next month. I was offered a position as the pain specialist for, I can't say it yet, but the largest animal health company in the world.
I know what that is. I know where you're going. Okay, well, that is They're very lucky, and what a perfect role for you. But actually, is there a web for an orthopedic surgeon? Where should people go? I mean, their primary care doctor can know one locally, so it's a beautiful thing.
The American College of Veterinary Surgeons. So if you go to the website, I believe it's acvs.org. There's a link from the CARE website to find a surgeon. So there's a link to find a surgeon. There's a link to find a rehab vet. So it'll take you to the websites so you can find a surgeon in your area, a board certified surgeon, and a rehabilitation trained veterinarian.
Nice. Awesome. Well, thank you so much. Everybody's saying thank you and great presentation. And I know this is super, super helpful. And it is the biggest thing we see here at Lap of Love is arthritis. And I feel like we see them when we could have helped. And so sometimes it's years prior could have helped, or like you said, starting when they're young.
Yeah.
Right. So, all right. Well, thank you again so much.
My pleasure.
Good luck on your new job. All right. Take care, everybody. Bye.
Thank you.